Hi, my name is Emine Akpinar. I am a PhD candidate in Yıldız Technical University, and also I am a researcher in IHIRC lab. Our study is about the comparison of traditional and tree-based machine learning methods in predicting the treatment outcome of high-intensity focused ultrasound ablation of uterine fibroid with an immediate non-perfused volume ratio of at least 90%. Uterine fibroids are the most common solid pelvic tumors. These tumors have many symptoms, such as pelvic pain, heavy menstrual bleeding, and also these tumors affect many women's life in the reproductive age. There are many treatment approaches for these tumors, such as hysterectomy, myomectomy, uterine artery embolization. And one of the treatment approach for these tumors is that high-intensity focused ultrasound, or briefly HIFU therapy. This is a non-invasive, non-ionizing treatment approach for these tumors. The main advantages of this treatment is that after the treatment, it allows the woman have pregnancy. To select most suitable patient for this treatment and also to interpret the result of this treatment, we can use magnetic resonance imaging or briefly MRI parameters. We in this study use multi-parametric MR parameters. These parameters composed of T2-weighted signal intensity of uterine fibroid, which give information cellular properties of the tissue. Apparent diffusion coefficient ADC maps derived from diffusion weighting imaging, which give information diffusive properties of the tissue, and also perfusion MR parameters derived from dynamic contrast enhancement with quantitatively and semi-quantitatively, which give information vascularity properties of the tissue. As I said before, we in this study use multi-parametric or the combination of these parameters to predict the treatment outcome of HIFU ablation of uterine fibroid. Recently, development in the computational technology, such as machine learning and deep learning, are very essential or important to evaluate the result of HIFU ablation of uterine fibroid. The main aim of our study was to comparatively evaluate the role of traditional and tree-based machine learning classifiers to predict the treatment outcome of HIFU ablation of uterine fibroid. We in this study use 73 women multiparametric MR parameters. These parameters were used as an input our machine learning classifiers, and then we evaluate the result of these classifiers. We in this study use 9 traditional machine learning classifiers and 3 MR machine learning classifiers. 9 traditional machine learning methods or classifier composed of logic regression classifier, passive regressive classifier, scholastic gradient descent classifier, linear discriminant analysis classifier, quadratic discriminant analysis classifier, linear SVC classifier, support vector machine classifier, k-nearest neighbor classifier, and Gaussian naive Bayes classifier. 3 machine learning methods composed of decision tree classifier, random forest classifier, and extra tree classifier. To evaluate the result of this classifier, we use some standard performance metrics such as EUROC, accuracy, sensitivity, specificity, and F1 score. We in this study use 12 most informative multiparametric MR parameters as an input our machine learning classifier. These most informative parameters starting with the K-trans ratio of fibroid to myometry and finish with T2 signal intensity of fibroid. You can see our machine learning classifier's performance, and the first classifier showed the best predictive performance with an AURC score of 0.92 and accuracy score of 0.96, and it's followed by the decision tree classifier. Its AURC score 0.92 and accuracy of 0.88. In this slide, you can see here our traditional and tree-based machine learning classifiers ROC performance graph. In the traditional based classifier, rich classifier, and also linear discriminant analysis classifier show the equal performance and best performance in the 3 traditional based classifiers, and also in the 3 based classifier, random forest classifier demonstrate the best predictive performance. To interpret our result, we can look at some confusion matrix of our base 2 classifier. For example, in the random forest classifier's confusion matrix, we can say that random forest classifier only made one mistake. It means that there are totally 19 MPV ratio above than 90%, and it predict all 90 this ratio truly, but it only one mistake. It means that it only predicted one MPV ratio below than the 19% as an above than the 90%. As a conclusion, we can say that machine learning algorithms or classifiers should be considered in assisting physicians to fully evaluate the outcome of HIFU therapy or HIFU ablation of uterine fibroid. Our study was supported by the Scientific and Technological Research Council of Turkey. This is our references. Thank you for listening.